Hi, I'm Dr. Mel. In this video, I want to talk about when is the critical period of dengue and why you need to know. Also, I want to refresh your knowledge about dengue, the signs and symptoms, and what you and your family can do about dengue. In this pandemic, where SARS-CoV-2 infection was the trending viral infection, actually, dengue hemorrhagic fever or dengue fever was never out of the picture. With the imposed restriction policy of the government, which started in early March 2020, and with all the lockdowns, we all spend more time at home, where most transmission of dengue from Aedes aegypti mosquitoes occurs. And to refresh your knowledge again, not all mosquitoes carry dengue. There are only two types of mosquito that carry dengue, and both can be recognized by the white marks on their legs and bodies. So that's the appearance of the dengue carrying mosquito. So you don't need to bring the mosquito in my clinic, hehehe. There's this mom who cuts the mosquito and brought it to my clinic. Hehehe, the mosquito came for a checkup. This mom wanted me to verify if that mosquito was the culprit because her two daughters were admitted due to dengue. These mosquitoes can appear anytime, but they are more common during the rainy season. In areas where they exist, the risk of the mosquitoes breeding increases every time it rains, but they can actually reproduce any time of the year. Just like now, it's summer, but I heard from the radio today that there are regions in the south and in Cordillera that they are having epidemic cases of dengue. These mosquitoes don't tend to bite at night. Actually, this risk is usually higher early in the morning or in the evening as it starts to get dark, from 6 a.m. to 6 p.m. Most people think there are only one dengue virus, but there are actually 4 different dengue viruses. All of them can exist in the same area at the same time, cause the same dengue symptoms, and any can become severe. Anyone in an area with dengue can become infected with any of the 4 dengue viruses. So, it's possible to have dengue multiple times, just like my patient who had dengue every 6 months for 3 times. Dengue is very distressing. If you have dengue, you have high-grade fever, usually 2 to 7 days, and on my experience, average of 4 to 5 days. It's very high, the fever is very high. There is also associated headache, vomiting, body aches, and muscle pain. So it's just like the symptoms of flu or even COVID infection. I had this patient last month who developed high-grade fever immediately after receiving the COVID vaccine. But because the fever, high-grade fever, was very persistent and she was very weak, so it's good she came to my clinic. Right from seeing her, with the many years of clinical experience of seeing dengue patients, somehow I have the clinical eye and suspect that she was already having dengue hemorrhagic fever, and that was due to the vaccine, because it's been 4 days that she had high-grade fever and she was looking very weak and flushed. She looks very red or flushed with signs of dehydration, so I immediately admitted the patient, and true enough, she had dengue hemorrhagic fever and even developed bleeding while in the hospital. After 2 to 7 days, average of 4 to 5 days fever, the patient fever will now start to go down, and this is the critical period of dengue that I want you to know. The critical phase of dengue begins at the effervescence, or the time that the fever lyses, and typically lasts for 28 to 48 hours. Most patients clinically improve during this time, but those with substantial plasma leakage can within a few hours develop severe dengue as a result of marked increase in vascular permeability. And the reason you need to know, because there are lives that are lost because most patients no longer come for follow-up once their fever disappears because they thought that they are well already. But for dengue, the time the fever disappears is the critical period. So please come back for follow-up for repeat laboratory test when you become afebrile. Because when you become afebrile, this is the time that complications of dengue will set in. This will be the time that your platelet will decrease. This will be the time that bleeding occurs and even shock, which is life-threatening. Please subscribe to my YouTube channel, Health.Faith.Fullness, and click the bell icon. If you learned something in this video, please share it to your friends, because I believe when the COVID-19 pandemic passes, and hopefully soon, dengue will still be a serious global health issue.